my screen here. I'm gonna pull up a little presentation I have. All right, you guys should be able to see it now. Okay, perfect. I see some nodding, so that's good. So what I'll do is I'll open it up a little bit here. I'm just gonna move this just a little bit out of our way so we can see the full screen. Okay, so big thing kind of want to mention with balance is just what goes into balance. What parts of our body, what parts strength, range of motion, what kind of factors into balance, and then also kind of what in our environment impacts it further, whether it's inside, outside, the weather, anything really that can impact it. Now we'll talk a little bit about fall risk and kind of what it is in general. How do we know if we are at a greater risk of falling? Different exercise recommendations if you are kind of having balance difficulties or if you feel like you are at risk of falling. We'll give you a couple of exercise recommendations for that. And then also just safety modifications to kind of implement in home or if walking outside in kind of the winter months coming up. So first kind of question I have just generally for most people, and a lot of people come up with their varying degrees, but why is balance important? Now on my end, I always look at balance as an important safety thing. So balance itself is important anytime you are moving, whether that's from laying down to sitting up, from sitting to standing, walking, going up and down hills, all that's really important. Now, a good kind of quote as to what I was looking at, what balance can be described as. There's two types of balance: an even distribution of weight, enabling someone or something to remain upright. Now, I think that's a very just broad but very all-encompassing definition of balance, because the important part is the distribution of your weight. How do we shift our weight to allow for best success to stay doing whatever we're doing, whether that's walking, whether that's cleaning, just general movement. And now the second part is more of a kind of feeling more balanced as a whole. So a condition in which different elements are equal or in correct proportions. Now, not necessarily what most people think of when they think of like balance and exercise, but I think it's really important in a sense that there's multiple systems that go into improving or making balance a little bit less successful. Now, it's a good segue into kind of what systems am I talking about? So the number one thing that helps with balance is going to be vision. So a lot of people kind of instinctually notice this throughout their life. What I mean by that is if you have trouble seeing at night when you're getting up to go to the bathroom, you'll put those kind of floorboard lights on to help guide the pathway. What you're doing is you're just instinctually helping your balance so that you can get to that bathroom safe and in an orderly manner. Now, there's different types of vision that kind of go into it. The central vision, what we're actually looking at when we focus our gaze, or a peripheral vision, kind of what's going off in the area that we're not necessarily focusing on. Now, other system that helps out a lot is big word here, somatosensory system. That's just our ability to sense touch on our hands, our feet. Anytime our shirt's on our back, we can feel it. That's that system. Now, that's important, especially with regards to the footing or the flooring that you're walking on. So it's a lot easier for us to pick up on sensory changes on a hard, firm floor versus a soft, kind of cushiony floor, or even like grass or a garden. Now, the final system that kind of plays a major role is our vestibular system, or our inner ear over here. Now, the kind of big part with that is it kind of tells you where your head is at in relation to your body. So this is a very common area that can be impacted with like vertigo or like dizziness when you're on a cruise ship, stuff like that. That's where this is kind of most commonly implicated, I would say. But it's really important in balance. Now, all of this impacts balance a little bit further. These aren't necessarily systems, but these are parts of everyday life or kind of how your body's feeling that will impact it. So eyesight, like we talked about further, a lot of disorders that impact the eyes, like glaucoma, detached retina type things can really impact our eyesight. And if you can imagine, and I'll go into a little bit more depth in the next slide, that if your eyesight's not as good, you're not able to pick up on those subtle changes in either the ground or our surroundings as easily, so it can impact balance. Posture is also a big thing with balance. As we get older, we tend to kind of get more of that forward hunched or stooped kind of posture forward. And what that does is that just moves our center of mass, or where most of our weight is distributed, forward. So our back muscles and our hips and the backside of our legs have to work a little bit harder to keep us up. So posture definitely impacts balance. Now strength, that makes a lot of sense. If we get off balance, do we have the strength to kind of bring us back up to our normal kind of standing position or our safe position? Range of motion also plays in kind of a general role. If you're not able to bend in certain ways or move joints in certain ways, when you reach that kind of limit, your limit, what can happen is other motions or other joints start to move that impact our balance a little bit further. Sensation and pain. I think this kind of gets understated entirely. Pain is one of those things that becomes an overriding signal to the brain. Now, the analogy I use is kind of if you were trying to walk across or run across a river full of alligators type thing. So you are going to acknowledge that there's alligators in that water, right? You're going to avoid that pain at all costs, even if it means that your balance while you're running across that river isn't necessarily the best. And so that's kind of a very extreme example of kind of how pain can impact it. We've already talked about vestibular function, but another common one is medications. There are so many medications that have the side effects that impact our ability to cognitively think, our ability to not move in or moving more in a sluggish manner. So all of that can really play a role in how well we're balancing. Some very common ones I see a lot in PT medications wise that impact balance are going to be the blood pressure medications a little bit more so. The ones that kind of lower your heart rate and blood pressure down, those ones can impact balance a little bit more. Obviously anything that is prescribed for nerve pain or muscle relaxers, those will also impact balance. So all of that kind of plays a role in just stuff that we have to factor in when it comes to balance. All right, so this kind of goes into more of that eyesight like I was talking about. This is how important eyesight can be to balance. So if you look at the pictures on the left here, the big things is kind of stages of glaucoma. And then you can see obviously as it progresses, we start to get more of this tunnel vision here. Now, a lot of the time people kind of learn to deal with it, unfortunately, and they don't understand that it impacts balances greatly. Eventually, when they do get the glaucoma or anything like that taken care of, it actually really helps their balance. And the reason why is you don't really have the ability to see anything in the peripheral field here. And why that's important, I have a golden retriever puppy, and she's a perfect example for this. She gets really, really excited and crazy and starts doing what I call the zoomies, the sprinting around my living room type thing. And if I could not see her coming out of the peripheral and she ran into my leg, I would go down. And that's just one of those things that if I could see her coming, one, I might be able to move out of the way in time, or two, get to the point where I can at least visually accept that she might hit my leg and kind of prepare for it. Kind of load muscle groups that'll help you, for lack of a better way to put it, take on that impact if a dog ran into you, if that makes sense. Now, that's more of the not processing enough information. So the other end of the spectrum is wrong information. So this is a very blurry picture of a very nice looking kid on a phone here. Now, the important part of that is if you have something that's a little bit more blurry in your field of vision, you can't pick up on those really subtle finite differences. So for example, I may accidentally bump into this kid because I don't necessarily have that cutoff between where their arm ends and where the air or the open space begins, because it's a little bit more blurry. Now, this is going to talk kind of more of that posture, that stooped forward posture here. And so this is labeled good and poor posture, but I'd kind of more so call it normal posture at a younger age, normal posture at an older age. Now, for the important part is you see this little line that starts at the top of the head here and goes all the way down to the feet. And if you look at the older posture here, where the line is, you can see how the head is in front. A lot of the torso is in front. A lot of the front part of the thighs are in front. So what that does is that just moves our weight a lot more forward. And so what that does is it makes all these muscles on the backside here have to work harder so you don't tip forward or fall forward. And that can, I'll talk about it a little bit further, but that can lead to stuff like fatigue, difficulties with walking distances you previously didn't, stuff like that. Okay, so this is a good chart on strength and generally how strength progresses or declines with age. Now, if you look at the bullet point kind of on the left here, there was a study by Gervin et al. In 2017 that just kind of looked at strength, peak, and age. So when do we peak with our strength? When does it start to decline? How much does it decline? And now this kind of busy graph on the right here does a really good job at that. So what they looked at, and I'll just kind of go through it, is this little dotted red line that's kind of really steep at the top, and then it tapers off and starts to decline near the end. That's the strength margin. So what it shows is about at age 30, that's where our strength tends to peak. Now, that does not mean that you are destined to continue to get weaker the moment after 30. That does not mean that. That just means that's the largest ability you have to maximize your strength. Anytime after that, you can still get stronger, but it's not going to be at the same rate, if that makes sense. So that's just important to know. As we get older, we do have to work a little bit harder to kind of keep the same strength levels. Now, what does this mean for adults? So early onset of fatigue, we aren't as strong. We have to work harder to keep that strength, so we're spending more energy to do so. So it creates a little bit more fatigue. Now, in the sense that we don't want a lot of fatigue with balance, because when we're fatigued, we start kind of making what I call our errors in our movement patterns. We start kind of letting gravity move us and instead of us moving us, if that makes sense. And the way I kind of describe it is, have any of you guys ever gone down a flight of stairs at the end of your long work day, and it just almost kind of feels like you're falling down the stairs, you're hitting a step really hard? That's what I mean by fatigue and error in the balance. You should be able to, even when tired, slowly lower yourselves down the stairs, but eventually we get tired, myself included, and gravity becomes too much for us to kind of overcome, and that's where that becomes a little bit more of a balance risk. Now, range of motion. So important, as we get older, our joint range of motion tends to decrease. Our flexibility tends to decrease, and overall that can impact our balance recovery. So one of the big things that I always tell people is, if you are really stiff in the morning or stiff at the end of the day, what you should do is try and kind of limber up as best you can, because that stiffness will limit our ability to do what we were kind of talking about previously. And a good example of that, and I'll kind of show you here, is that early morning, I always call it that first standing up kind of thing, where we're sitting in a chair and then we kind of, stand up. And we're kind of like, that slow kind of stand up thing. What we're doing there is trying to get our joints nice and loose to allow us to stand a little bit more in line with our feet position. If we aren't able to do that, what we do is our trunk weight is so shifted forward that, again, we fatigue a little bit quicker. Our hip muscles have to work a little bit harder just to keep us upright. Eventually, when we can get our back or our hips nice and loose and we can stand upright, it almost dissipates or gets better. But in that time, that's where that balance risk becomes a little bit more prevalent that we have to watch out for. All right, so sensation. As we get older, our sensation in our hands, feet, our ability to sense kind of light touch tends to go down in general. And then I kind of put a little snippet in there. It generally has to do with the circulation changes as we get older. Either not as much blood flow or arteries getting a little bit more narrow, but all very normal. Now, but when this happens, we also have to understand that those three systems that I talked about in the beginning, so we now know that our vision gets less as we get older, our sensation gets less as we get older. So that's 2 out of the 3 systems for sure that we know have generally get impacted by our age. So it's stuff that we have to be attentive to just so we can kind of make those fine-tuned changes so we don't have to worry about balance. Now, sensation is also important in a sense that we have to be able to sense our change in position of our joints. Now, what I usually kind of demonstrate for people, and what I mean by that is when we are kind of moving our arm here. So I can tell that I'm moving my elbow right here without even looking at it. And that's the sensory cells in our elbow that tell us that. And as we get older, those cells tend to diminish as well, so we can't do that as efficiently. Now, if we can't do that as efficiently, what happens is let's say we don't have as much lighting and we step kind of in a little bit of a hole in our yard, or like my dog, a hole in the yard, or a rabbit hole, something like that. Our ankle position, the joint itself, will change because it's not that flat ground we were expecting. And if we don't sense that change, it will impact the rest of the leg, so the knee, the hip. And if it is such a great change that it impacts it so greatly, you may end up losing your balance. So it's important for us to be able to sense those changes quicker to allow for us to recover if we do become off balance. Now, pain. This is the big one here that I think doesn't get enough attention with balance. If you are in pain, your muscles will not activate as well as they could or should. And what does that mean? That means that when I'm falling over, let's say I'm falling forward and my back's in pain, I will not be able to activate those muscles in pain as efficiently. I may be able to activate them enough to save myself from falling, but I may not be. That's the importance of pain. So if we can address our pain, it'll help with balance. All right. How does the environment impact our balance overall? So inside the home, I think there's a couple of things that I just always tell people: monitor, try and minimize as best you can. And that's general clutter. So if you know anyone or are someone who tends to accumulate items throughout your life and not kind of get rid of any or throw any away, and there's a lot of clutter around, I always tell people minimize the clutter. Try and make it enough space so you don't have to worry about bumping into anything or having to kind of move awkwardly through a certain walkway, anything like that. You want to minimize it. You want to minimize a lot of the throw rugs as well, because that's that change in footing that we're talking about that can really impact balance. And a lot of the times those throw rugs, unless you kind of have a really solid grip mat underneath them, can slide as well. And that's also another balance hazard. Stairs are important. Obviously, with two-story houses, we have to have stairs. So the big thing I always tell people with that is make sure you're putting lights in your stairs. It doesn't have to be a full overhead light, but even something like those floorboard lights, just so you can see each step a little bit easier. That generally makes it a little bit safer. Now, the bathtub and shower floor, a lot of the things I kind of promote is more of that grab bars, not the ones with the suction cups either. The ones that you can really drill mount into the bathtub or the shower wall. Those are the ones to talk about. And non-slip mat to the bottom of the tub, also a big recommendation of mine. If you have the ability, a shower without the tub lip in it is a little safer, in my opinion, one of those walk-in type showers. That's a little bit more of a want versus a need type thing with regards to that. Outside the home, I think all of us being in the state of Wisconsin, we're familiar with snow and ice. I'll go into kind of further discussion in a couple of slides about how to best navigate snow and ice when you have to go out in it. Other things that impact it is the surface you're on. So solid concrete versus grass versus a nice sandy beach once COVID's all done, that kind of thing. Stairs are different. Ramps can be a little different. So this is the fall risk winter minimization slide here. So for the next couple of months, guys, I want you to think about this entirely. So number one, first and foremost, wearing good shoes with traction. So I am a poor example of this in the middle of winter because I'm wearing dress shoes most days, and they are very, very slick. Now, you want a good shoe with a lot of tread on the bottom of it. Now, the picture I have here, this individual, I don't know him personally, but I'm assuming he didn't think the shoe tread on his bottom was good enough. So he went out and got snowshoes. You don't necessarily have to do that. There's other items that you can attach to a shoe that create a little bit more traction. If you want them, I can send over some resources, but they're pretty common at like the outdoor places, REI, Cabela's, even Dick's Sporting Goods. Number two, and most people do this already, dressing warm. So the reason I say it's important to dress warm, not only just to stay warm, but when you're really cold, does anyone kind of get in that kind of position? Every shoulders come towards the ears, you really are tense. And so when that happens, it doesn't allow us to react as quickly. We're a little bit stiffer. So if we do lose our balance, we tend to kind of fall a little bit harder. We don't have as much of a ability to recover before we lose our balance entirely, that type of thing. So dressing warm, making sure that those muscles stay as loose as we can, those joints stay as loose as we can. That's pretty important in the winter. Do not walk on uncleared sidewalks or paths. Now, I've had a couple of questions on this in the past where people have actually walked on the snow to give more traction versus a unpaved or a paved kind of walkway that's a little bit more icy. And in that sense, it's kind of a little bit of a gray area. But for the most part, I tell people try to avoid walking on uncleared paths because you don't really know how deep it is. You don't know if it's a solid packing snow. You don't know if it's solid ice. You don't really know generally if there's a hole underneath all that snow. And so just that uncertainty creates that little error for our balance that we don't want in case of falling. We don't want to fall. So all of that, I would say, if it's paved, you can at least see what you're walking on, which is a big help. Now, with regards to usually the next question I'll get is usually, what about driveways that have a little bit of ice on them? They're cleared off, but you can definitely see some ice. I always tell people, and I'll kind of go into a little bit further, if you have to walk over a little icy area, and I mean absolutely have to, what I tell people is try and kind of spread your feet a little bit farther apart so you have a little bit wider base of support. Then what you're going to do is take smaller step lengths. You're not going to want to take a large step length while you're on it. You're going to kind of do a very small step. What you're also going to want to do is try and lower your body. So you're not going to want to walk really upright. You're going to kind of want to walk a little bit more crouched forward or down to give yourself a little bit more proximity to the ground and your center of mass not up so high. Allow extra time, and I missed the second one above, but allow extra time to get places. Because we're having you do a little bit different things, walking a little bit slower, walking with your feet a little bit wider, generally just allow more time so you don't feel rushed. I cannot tell you how many patients I've had who have fallen at home because they were rushing for one reason or another, whether they were rushing to an appointment or their husband or wife was walking faster than them, they were trying to keep up kind of thing. Do not rush. I always tell people, I was like, with balance, you are one of a kind. You are not at all like any other person. You function with balance how you function with balance. So if somebody's able to do something a little bit faster or a little bit slower, that's okay, but that's them. That's not you. You focus on how you balance. All right, going to the next one. Exercise caution when getting in and out of a vehicle. And this goes to kind of more of that black ice, unsure footing. You're not necessarily able to look directly at the ground as you're getting out of the car, that kind of thing. And that's where we kind of get more of that uncertainty. Now, I put a little snippet in there. Use the door or door frame to assist when stepping out of the car. Now, one thing I always tell people too, in the middle of winter, and I'll kind of lower my computer screen down, if I'm sitting in a car, I don't want you to get out one leg and then try and stand from that position. I want you to lift leg out, turn, lift your other leg out, and then you use that door frame in front of you to help stand up. Okay? That's just going to be allowing for you to use more muscles, but then also use your eyesight a little bit better to help, as well as the car frame itself. Walking in well-lit areas, and that's just, again, to avoid black ice. We want to have the most chance for success, so light allows it for that. And then just in general, trying to keep ice and snow clear as best we can. If we can't, using those handrails or even walking sticks with, some of them come with little ice kind of, I don't want to say ice pick, but more of a pick that can get stuck in ice to help with balance. I've had patients use those and be very successful when they had to walk across snow or ice. All right. So how do we improve our balance, or how do we become aware that we need to improve our balance? So one thing that we do a lot in at Capital here is we do a lot of fall risk screens, and we generally do that with most of our balance patients we see, but also just general lower extremity strength patients that we need to get stronger, just because balance is everything. If we're not able to stay on our feet, we have a lot more of an issue long-term ahead of us. So that's important. How do we improve our balance? We decrease our pain. We increase mobility. We work on our posture, improve our strength. And I'll go all through these exercises here in a second, but these are kind of just the snippets on how to reduce fall risk or improve balance overall. Now, fall risk screens here in clinic, there's a couple that we kind of really do a lot of. The evidence supports their efficacy for use, and they're listed right here. But the important ones that I like to talk about are more of the functional ones. So a lot of people most notice their balance when standing still, when getting up out of a chair, when going up and down stairs, or when they're changing direction. So like if you were in a grocery store and you forgot something in the produce section, you have to kind of turn around with a shopping cart, that type of stuff. Now, all of these take different components of your balance. So your ability, so this picture here is a picture of the timed up and go test. And so I like it because it takes into all those things I was just talking about. Your ability to stand up from a chair, your ability to walk forward, your ability to turn around, and then at the very end, sit into a chair. All of those, I would argue that the majority of the world does on a daily basis. We stand up from a seated position, we walk forward, we turn our body, we change direction. So if this is done and it shows something like a little bit of a balance dysfunction, or we get unsteady at a certain point, that helps myself develop a good plan on exercises to get you stronger, get your balance a little bit more better, or a little bit more efficient, I should say. Now, these are a couple of postural exercises that are really good to kind of really minimize that aging posture of us kind of coming forward. Now, the important things for these ones is with posture, you can't really do enough of these ones. Like I have over here, 10 times every hour. So if we're doing the math, that's 240 times a day if you don't sleep. I'm kidding, but this one, honestly, you can't do enough. Now, for here, these top two are very important for our trunk stability. So a lot of us, as we get older, and even more so in the younger generations nowadays with cell phones, we kind of get in that kind of forward head, stoop posture type thing. And what that does is that just creates more of that strain on the backside of our muscles. So this first exercise here is a chin tuck. So I'll kind of just show you how to do it here. What you do is you sit up nice and tall, and you're going to just try and bring your chin directly behind you. So you're going to go here, and then I call it the double chin exercise. It's not the most good-looking exercise, but it's really effective at helping this neck, one, get a nice stretch near the top part of the skull, but also improving posture for balance. Now this next one is a shoulder blade squeeze, just trying to bring those shoulders backward. And so if you can see me here, if I'm starting kind of here, what I want to do is just kind of roll those shoulders back, really trying to squeeze everything back. Now for those, that's one of those two exercises that I would say doing 10 times every hour if you can, or just whenever you can think of them. Like if you were sitting there at a computer desk or playing cards or anything like that, and it's not necessarily your turn or you're taking a little pause, these ones are easy to do just to keep everything moving. Oh, what did I do there? There we go. And now these other two are more so focused on getting your hips in a better posture. So a lot of times as we get older, the front part of our hips tend to get really tight. And when that happens, the back side of our hips tend to take a little bit of I call it a day off with regards to strength. And so this first exercise is a stretch for the front part of the hip. Now I tell people that if you lay on your bed and you just let that leg dangle off, that's more or less the very same stretch this picture is depicting. It's really good at kind of loosening up the front part of the hip to allow you to stand up nice and tall, so you don't have that kind of forward flexed kind of position, if that makes sense. And then this one next to it, I'm confident that hopefully some of you have seen this one before. It's called a bridge exercise. And so what this individual is doing is just laying with her knees bent on the table or bed. And then what she's doing is she's just squeezing her buttock together, and then she's just trying to lift her buttock off the surface. Now, I tell people when they're first starting this exercise, don't worry about getting your bottom up that high. The main part of it is just to really work on what muscles we want stronger. So that buttock squeeze I was talking about is the huge part of it. Other exercises for strength that are really important are hip and core stability exercises. And if you think about it, that makes sense. If we're losing our balance, we don't want to have a lot of flailing limbs or body parts going around. We want to make sure that our core and our trunk and everything we're standing on is a really solid support system, so it doesn't kind of feel like we're standing in an earthquake. Now, more importantly with this one, I try to make them functional. Again, the big thing is function. Balance is the most functional thing you can think of. We have to do it in every aspect of life. So let's say, for example, if you're having troubles with your balance when you're standing up from a seated position, whether it's a low seat, a high seat, a cushioned chair, or a hard back chair, that's something where we work on that exact movement. So we stand up from a chair, slow and controlled. The slow and controlled thing is the most important. When we do everything slowly, it challenges balance the most. So when I always run into this, when people do this sit to stand early on, what I'll see is, and I'll show you kind of from the side view here, is a lot of throwing your body forward to try and help standing up, which is a way to be successful with the movement, but it's also a dangerous way to be doing that movement. We want to be able to do stuff like this slow and controlled to make it so those muscles are doing it, not your momentum. Now, other things we can do are like modified squats. Let's say, for example, this is too tough for some people. What we do is we modify it and we make it a very similar exercise. So most people have a kitchen sink or like a laundry room sink to hold on to. And I usually tell them, do a sit to stand using that kitchen sink to hold on to and using your hands to help. That allows you to get good form, keep that slow and controlled movement, but also maintain the safety throughout. Now, these ones over here are a little bit higher level core and hip stability exercises. This one's called a bird dog. I would say don't worry so much about this one or this one just yet. But this one here, the sit to stand, is a very good one to start with. Now, other ones I have listed are going to be the heel raises here. And these are really important. I don't have them pictured, but that's where you would stand next to your kitchen counter and then just go up onto your toes and then slowly back down. Those muscles are really important going up and down stairs. They're that last little bit of ankle thrust, I call it, that gets you up the stair or helps control you going down the stair. And then general balance exercises. So I always tell people, if you're practicing your balance at home, the first and foremost thing to think about is safety. I don't want anyone practicing any balance exercises without safety being the thing predominantly on the front part of their mind. Now, how do we do balance safely at home? So none of these pictures are great for that. But what I would tell you is the kitchen counter or table at home is the more important thing to use. You don't have to completely use it, but if you do need it, it's there for you. Now let's talk about some of these exercises pictured here. So from the last slide, if you remember, I was talking about those heel raises. This individual in this picture is doing a heel raise on a really unsteady foam pad here. Think of it like a Tempur-Pedic mattress for your feet, okay? So it's really unsteady, it's really kind of cushiony. But when you do stuff like that on the pad, it creates a similar feeling of like being on an unsteady surface. So for example, I have people do the heel toe balance test quite a bit with their hands on the counter. So one foot right in front of the other, just holding for 30 seconds. If stuff like that's easy, what I tell people is this blue pad can add a little bit more of a challenge. So if someone had a difficult time with walking on a garden surface or the uneven ground of a yard, this is also something that is very helpful. Now, you don't have to go out and buy something like this. You can mimic stuff like this with like a throw pillow or a folded up bathroom or a beach towel, something that just gives the surface that you're standing on a little bit more cushion. And now even simpler, if you have a wood floor versus a carpeted floor, that's the easy, you don't even have to buy anything or move anything. That's an easy increase in challenge there. Now, you can do 2 feet balance drills like this, or even harder, one-legged balance drills to really work on your ability to tolerate standing on 1 foot. Now, a lot of people, even when I see them in clinic here, will ask me, Tyler, why am I standing on 1 foot? I do not need to do this ever in life. And I completely disagree with that sentiment. And here's why. Anytime you take a step forward for a little bit of time, you're on 1 foot. And now if you do a lot of walking, add that up over a length of time, it pretty much will equate to the same amount of time. So we got to get you really endurance based to allow for that longer walking. We got to have you able to tolerate being able to hold a one-legged stance position longer so that you can walk a little bit farther, if that makes sense. Now, these drills right here, if you see kind of this lady here as well as the gentleman up here, are really good to help with dynamic balance. Like if you have difficulties when you're moving on your feet, like if you feel like it's tough for you to walk forward without using a walker, or to move to the side without feeling like you're going to lose your balance and fall over, what they do is just really promote mobility on stability. So one leg stays still while the other leg is moving. Gait training, this is a huge one. So a lot of people have balance difficulties when they're up and walking, which is very normal. Now, the best ways to get better at anything is to practice it. Now, if you guys remember earlier on, I said the big important thing with practicing is safety. I don't want anyone practicing this on their own without someone there to help, or a system like these parallel bars there to help, just for safety. Now, let's say, for example, somebody has trouble going up a curb, and that is very different than stairs or steps for the most part, because curbs don't have any railing to help up usually. Now, a lot of the times I tell people to actually work on something like this first when going up a curb, where you're just kind of lifting that leg and putting that foot onto the top of the curb, and then lifting that leg that you put on top of the curb back down. And that just gives you that good control and initiation of that movement. Then if we get really good with that, then we work on stepping over objects. So lifting that leg, placing it over, and then being able to lift that trailing leg over as well without knocking into objects. This is a big thing with regards to motor control and coordination, because that also can be impacted with balance. Now, again, I do a lot of that here. I very seldomly tell people to practice this on their own at home just for safety, but this is something that's also very important. Now, let's say, for example, we do all of that, and for some reason our balance is still a little bit more of an issue, and it's something that creates a risk for falling. So stuff that we want to work on, and this again I only do in clinic, are balance recovery strategies. So when we are off balance, can we retrain our muscles, our nervous system, to help us recover balance before it's too late, i.e. when we fall? Now, there's 3 strategies that I work on in clinic here: the ankle strategy, the hip strategy, and the step strategy. Now, I'm not going to go into too much depth into what they are, but I always tell people, imagine you are kind of walking on the edge of the Grand Canyon, a nice scenic trip. You get a little close to the edge, and what ends up happening is you kind of have, I don't know if you've ever seen those like old Looney Tunes cartoons where somebody's on a cliff and they're kind of flailing their arms going back, that kind of thing. What they're doing is they're actually using some of these strategies to help pull their body back up. So this ankle strategy, if I were to lose my balance backwards, what I want to do is help stimulate the front part of the ankle muscles to help pull us back upright. And just the opposite, if I'm falling forward, I want to train this backside of the ankle muscles to pull you back upright. Same thing with the hip, exact same idea. Now the step strategy is a little different. That's for when we get really off balance and we almost have to take a step to recover our balance. We work on stuff like that so that in those times where you do have to take a step to recover your balance, your strength is there to allow for it. Your range of motion is there to allow for it. These are some exercises. I'm not going to go into too much detail on them because they can be a little bit tricky. But these are exercises for your inner ear. So that organ that I was telling you kind of shows you where your head is at in relation to your body. These are exercises that help reduce that. They also can help with dizziness. So if dizziness is why your balance is a little bit off, these are what I would say I would focus on for you. All right, I think this is one of the last slides I have before questions. But these are just kind of the in-home balance safety tips I was talking about earlier. So just removing any clutter. So one thing I forgot to mention earlier was that the loose cords on the ground. My parents are a great example of this. They have a lot of extension cords that just traverse the entire center of the room. And I've educated them a lot, but a lot of the times they create a fall risk. If you catch your foot or your toe on that cord and create a little bit of a stumble, it can create that fall risk that we don't want. Adding grab bars into the bathroom. So this picture I included here is, honestly, I look at it and a lot of people say, do you think that's overkill? Do you think that's too much? And I tell them no. And the reason being is we get in and out of the shower differently. We don't ever really get in the shower the exact same way every time. We may get out the back side. We may get out the front side. We may have to get into a shower chair using this one or this one to help us stand as we're washing our hair and our eyes are closed. All of them are very important. And I would say with shower grab bars, more is better. That's the important thing. And then shower chairs. This picture doesn't have it, but this is really good for those who get really tired in the shower. Some people shower for a little bit longer. Some people shower a little shorter, but you can get really tired just with the standing part of it. And in this specific scenario, if you're tired in your shower and you have this big tub to try and step out of, that's where we kind of get a little bit worried with the fall risk. So using something like a shower chair just to conserve energy and also just generally make it a little bit safer because you don't have to stand as long, good option. And then this one, appropriate lighting. Lighting. We don't want any kind of dark stairwells, dark areas in the hallways where we can't really see the footing. We want to make sure everything's nice and light. And that's all I really have for today with regards to balance. I guess I'll open it up for questions. Does anyone have any questions today?